We've been working on different methods and different ways to help solve this problem for quite a while now.
A glimmer of hope after southern New Hampshire's deadliest month for suspected opioid overdoses.
That's the most alarming thing in my opinion.
18 suspected overdose deaths, 13 in Manchester and 5 in Nashua. The most that American Medical Response has seen since it started tracking the stats in 2015.
That is a high number for Nashua. We usually don't see such high numbers.
The problem isn't the number of overdoses. It's about the same this time last year for Manchester and even lower for Nashua. The alarming numbers are the overdose deaths. They're up 41% in Manchester and 27% in Nashua.
I believe there was a particularly powerful batch of fentanyl that came up from wherever it comes from that made its way to southern New Hampshire, and when people used it, they died.
The people that are overdosing are more likely to have a fatality than in previous years.
After the large spike in February, Manchester announced its rapid assessment response teams to help educate and stop people from overdosing. They've already been deployed in Manchester. However, Stehwaz also believes that there would be more deaths if the public didn't step in with Narcan.
New Hampshire has been very good at Narcan administration and making sure that it's distributed widely and it's available at low cost or free in a lot of cases, so that has definitely saved lives.
Now, New Hampshire is actually one of the only states in the country that keeps track of the public's use for Narcan, and AMR hopes that continues because they project by the end of this year that there are going to be 111 opioid overdose deaths, and that is the highest number that they have seen since they started tracking those stats since 2015. Live here in Manchester, Troy Lynch, WMUR News.